Are there guidelines that will tell you if you need medical treatment or if you need surgical treatment, or what is the treatment?
So everybody gets medical treatment, and there are guidelines that sort of indicate whether you need to have more aggressive surgical intervention. The interventions would really be medical or surgical. Those are the two choices, and medical intervention would be aspirin, cholesterol medicine, lifestyle modification for
exercise, eating properly, losing weight, the things that we want everybody
quitting
to
smoking.
do. And quitting smoking. That's probably the most dangerous thing somebody can do, isn't it? We know that smoking cigarettes, the nicotine will damage blood vessels, lets the cholesterol deposit, leads to the hardening of the arteries, leads for the need for an endovascular surgeon to correct a problem that's going on. Do most people have symptoms if they have carotid artery disease?
Not necessarily. Again, I think that's why it's dangerous. It can be silent until there is a stroke, and then you've lost some time.
Yeah, and so when somebody has carotid artery disease and they're going to need surgical treatment, are there different kinds of surgical treatment?
There are. You can have an endovascular treatment, which would involve a stent in the carotid artery, or you could have a carotid endarterectomy, which is where we actually go in, open the artery, and clean out the plaque.
I'm going to want to learn about that, because I've got a picture in my mind what an endarterectomy would be like, how you would clean out the plaque and how you would put in a stent, but I really don't know, and I'm going to learn tonight on that.
Okay.
Now, how successful is medical treatment? So if we know somebody's got some problems with cholesterol plaques, narrowing of the carotid arteries, are people successful with cholesterol-lowering medicines, exercise, eating properly, losing weight? Do they do it? Can they really improve?
Actually, more so than you would think. If people are real compliant with medical therapy, they can halt the progression of their disease. In general, it is not particularly reversible, but they can keep it from getting worse. So in a person who's not having symptoms, who has an incidental finding of carotid artery stenosis and doesn't need anything done, they can go on to not need surgery if they modify all those things.
How often do you need to get that ultrasound or evaluate that? If somebody was found to have asymptomatic, wasn't bothering them, narrowing of the carotid arteries, how often do you repeat the studies to see if the medical treatment is working?
In an asymptomatic person with less than 50% stenosis, I usually wait a year or two. In someone with more than 50 or 60% stenosis, every 6 months.
So when you say 50%, do you mean of both sides or one side?
One side. Each side treated independently. Okay,
so they're treated independently like that. Do you think most of the time both of them are diseased when you see it or not? I don't know.
We always look at both as a surveillance, sort of as to know, but we treat each side differently. So if this side were 70%, we would watch it every 6 months. If this side were 50%, we would watch it every year. Okay,
and so that would give you an idea of if it was worsening. Can you tell if there's a 10% worsening by an ultrasound?
Again, going back to those categories, 10% is probably a little bit much to tell, but if you change your velocity of blood through there, or if you bump a category, then that tells us it's getting worse and we might be more aggressive.
I think it's fabulous that you can get this information that can allow us to attack medically and surgically to fix a problem so that we can prevent somebody from having a stroke.